Good morning, Dan Delmar in for Elias just for today. A recent report highlights pay discrepancies between male and female doctors. Male doctors earning significantly more, of course, than their female counterparts. And despite qualifications and experience, women in medicine are making on average about $105,000 less a year than men, a gap that persists across various specialties. Again, despite them representing 70% of the workforce. Dr. Laura Sang, family doctor in the Laurentians, joins us to comment on this. Dr. Sang, hello.
Hi.
I'm pretty surprised at the finding, a discrepancy of on average $105,000 according to this study. What's your take on this? Do you think that figure sounds about right to you?
From my anecdotal experience, that seems to corroborate with what I've seen amongst my colleagues. I think there are several reasons for this, and that it's sort of a very complex thing to untangle and figure out exactly what's going on. First of all, I think a lot of it has to do with the way that doctors are paid in our current healthcare system, that fee-for-service, that favorizes, a more volume-based way of compensation, that you get paid more if you see more patients, regardless of the quality of care that you're giving. So I think that there might be some differences in the way patients are being seen between different types of physicians. For example, I know a lot of my male counterparts tend to go for more procedural-based practices where you can do more volume and you get paid a certain amount for a procedure, whereas a lot of my female colleagues tend to go into specialties where you might need to take a bit more time with patients. I know I personally work, in a family medicine clinic, as well as in a rehab center for patients who've had strokes, car accidents, etc. And I have to spend a lot of time, untangling medications, going through lab results, things that might not be as well compensated as if I was, seeing a patient every 15 minutes and doing a vasectomy, for instance.
Were you surprised at some of these figures, which, by the way, are coming from RAMQ itself, so it's not, these are pretty precise figures, but in sort of your immediate space, are there a lot of male doctors who are earning that much, significantly more than their female counterparts? And the key part here is based on similar experience. So is there some discrimination from what you see with this discrepancy?
To be able to truly comment on that, I would need to see the data and see the analyses. We always worry about things called confounding, which is there something else in this data that is skewing it? Is there something that could be contributing that we didn't acknowledge? So I think that would be the most important step is, really going through that data. But am I surprised? Not necessarily. We know that there is still, discrimination against women in the workplace in various forms. I know some of my colleagues, again, anecdotally, because I cannot speak on behalf of everyone, that certain, they've had experiences where certain colleagues would ask them to do more of the administrative tasks or things that aren't necessarily as billable. So there's some of that. I think there might also be differences in the way different people practice medicine, and that, again, men might be more interested in, a volume-based practice, whereas women might be more interested or favor practice that is very much focused on that more holistic care, which in the way the current billing system is set up doesn't necessarily allow for a more lucrative practice. But again, I think we really need to go through this data with a fine-tooth comb to understand what is happening here. And I think that the solution, at least to trying to solve that pay gap, is to change, in part, the way physicians are compensated, or at least offer a certain flexibility to help people optimize their salaries.
Family doctor, Dr. Laura Sang joins us. When we're talking about, I guess, systemic fixes here, there doesn't seem to be a lot of willingness to do that. On the contrary, the government seems to be sort of more focused on volume, right? Is that what you're noticing as well over the past few years?
Yeah. So in the way that our current billing system is set up, it's that we have to see a certain number of patients, a certain number of days per week. And if we don't abide by these obligations, they'll cut 30% of our pay. I have a few colleagues that I know that have taken this 30% cut because they've had children, they've had sick family members, they needed to reduce their clinical hours to care for others or to avoid burnout. So I think that that's part of it.
Sorry, go ahead.
No, go ahead.
I was going to ask if you see maybe that some specialties in medicine have more of a gap, gender gap, than others.
It's hard for me to comment on other specialties as someone who really works in family medicine, and I think it would be really interesting to hear from people in other specialties. But again, anecdotally, from my female colleagues that I've spoken with throughout residency and who I've kept in touch with from med school, I know that there are certain things that are experienced, but I don't feel like it's necessarily my place to comment on those. But I think what we need to do is really work on having a more flexible payment system. I know personally for myself that, I have hundreds of lab results that come in per week, and I have to take an entire day where I don't see patients to try to get through those to make sure that, urgent blood results are taken care of, that people, are contacted and know what to do based on the results. And unless I call a patient, anything that I do in their chart, whether it's just writing a note, looking through lab results, none of that is compensated. So there's one whole day a week that I'm working where I'm not compensated, and that's pretty typical that family doctors spend about 20% of their week doing unpaid work, going through lab results, that sort of thing. And I don't know exactly what's happening between my male and my female colleagues, but I'm wondering if in part the way that results are managed might be another contributing factor to that data. And I think that's something that needs to be addressed, that we need to be compensated for the work that we're doing, even if there are differences in the way that we work, that the pay reflects the work that we're doing, because I know my colleagues are working the same number of hours, if not sometimes more, than their male counterparts.
Just to push the problem a bit further, I mean, obviously there's a lack of resources that for sure is an issue. Is there a lack of personnel, a lack of available doctors? Does it all come down to money at the end of the day? I mean, what you're describing, a more holistic, a slower form of care, I think is one that a lot of Quebecers would like to see. Whether it's perceived as more female, I'll leave that question open, but certainly it's a better way of caring, but it doesn't seem to be what the government has in store for us.
I think that with regards to what I would consider to be the healthcare crisis that we're entering, on paper, volume looks good. If you're being able to see as many patients as possible in a day and that you're just giving more access to care to people, that looks good. But that sort of fast food style medicine, I think, comes at a cost. That if patients aren't able to get all of their concerns acknowledged, bring up all of their problems, you're going to miss things that could have a huge impact on that person's health and lead to ER visits, hospitalizations down the road. If you can catch things while they're small and manage them while they're small before they get big, that helps everyone. That helps patients, that helps finances. And I think that making sure we have that kind of access and the time to care for people as best as we can will avoid that in the future. But I understand if you have, 100 people with a pneumonia trying to get seen at a walk-in clinic, these acute situations tend to kind of take priority in the government's eyes. So it's a very challenging, thing to navigate, to try to just optimize the care that we have with the resources that we have.
Dr. Laura Sang, we won't take up any more of your time. I'm sure you're very busy today. Family doctor in Saint-Hippolyte in the Laurentians. Thanks very much.